And in view of the current trends regarding the COVID-19 third wave, the Academy of Medicine Specialties and Rapid Response Initiative Group of the Academy of Medicine Specialties, headed by Professor Oladapo Ashiru, has issued a statement that Nigeria should close international airports to all flights for at least 2 weeks. The group revealed that 5 sequences of the India B1617 COVID-19 variant is in Nigeria, specifically in Edo and Osun states. In the press release, the Academy drew the attention of the federal government as well as the Presidential Task Force that transmission is still active, although at a low level. And also says that the low-level transmission is due largely to the lockdowns going on in Europe and some other countries. The Academy added that the ongoing transmission in the country is caused largely by those inbound passengers from India and those countries with surges in the cases reported daily. Now, many of them, they say, travel into Nigeria through indirect flights. The Academy maintained that the urgent need to enforce the use of the Presidential Task Force regulations of social distancing, hand sanitizers or washing of hands, as well as wearing a face mask, is very paramount. And now joining us for a chat on this new development is renowned Nigerian Professor of Virology, Professor Oyewale Tomori. Thank you so much, Professor, for joining us. My pleasure. And I also think that you're part of the advisory group that has issued this statement, this Academy of Scientists in Nigeria. But for Nigerians that are watching and have seen the turnout of numbers in recent times by the NCDC as very low numbers, and try to juxtapose it with this advisory issued yesterday, help them make sense of it. Would you say Nigeria is out of the woods, and why should they be concerned about a third wave when we're recording very low numbers?
Thank you. Nigeria is in the clearing within the wood. The wood is still around us. We just have a little clearing. And if you check the figures that NCDC is giving, as how many states are actually reporting, that's where we should look at that. It is possible that we're having a lull, but India also had a lull, and now they have a big epidemic. Once you slow down on your guidelines, MPI, the non-pharmaceutical interventions, and once you begin to aggregate and congregate like the people in India did at the River Ganges, well, we expect another wave to come. And so I think we're in a lull period. And if we don't take our time, we probably will get a third wave, whether we like it or not. Now, as they have discovered the variants that is coming from India, we don't know how many of it we have because we're not testing enough, and we don't know exactly when they arrive in the country. So it's possible it is spreading in the country, and we don't know where they are going and what they found in Osun and one other state. So who knows? Maybe in other states too. Okay. But one other point I think we need to make: the issue may not be the banning of flights, because there's no direct flight between Nigeria and India. And many of the Indians who will be coming from there or Nigerians going there go through different flights. So it's going to be a little bit of a problem banning flights. Our target should be on the passenger, not on the flight. Okay, proper scrutiny of anybody coming in from India, in the last 14 days or so, check them, quarantine or isolate them until proven otherwise.
Thank you. You actually went where I was planning to go, so I'll just follow you there. I was basically going to say that a lot of the countries, even when they've put India on the red list, have proceeded to either do a tracking or they found other ways to control the situation. If we ban all international flights, it sounds a bit of an acute measure and perhaps not very thought out. What are your thoughts about the vaccination program on the back of that observation?
Well, I mean, obviously, we're not doing as well as we should do because we don't have the vaccines. We are begging for vaccines. So you can only do with what you have. We're supposed to have gotten 4 million doses. Now I think we've vaccinated about a little over 1 million. We still haven't even reached, if we were going to vaccinate everybody with 2, we still need to get to 2 million doses so that we can vaccinate the 2 million with 2 doses. So we're moving, we're plodding on slowly. Too slow for comfort. Again, we don't even know when we're getting the next batch, which makes it even less comfortable. So I'm a bit quite worried that dream of getting the so-called herd immunity will take us years longer than we think.
Well, Professor Tomori, for those who say we have tried this before to follow the passengers and not to ban the international flights coming from the high-burden countries, we still recorded cases from those countries because at that time, the Presidential Task Force talked about sharp practices and those cutting corners. So would it not be better to just ban the flights from those countries as we are seeing in other countries at the moment?
Well, you raise the very important point. The countries that even have banned the flights are also doing good, thorough checking of all the passengers. Like I said, how many flights are you going to ban? Anybody can come into India through any source. You can come in through UK, you can come through Dubai, you can come to the Middle East, you can come through Africa, you can come through South Africa. So what are you going to ban? So that's the problem with banning flights. The important thing, as you said, is tailoring and monitoring the passengers that are coming in. And that's a major problem with us. We have sharp practices, we do things that we should do. Our people are not that honest enough, and that's where the problem is. So it still won't solve the problem, even when you ban all the flights. People will still coming. I mean, Indians will still coming through the border. Where they're not, if they go through Togo and come by road, how are you going to stop them? So okay. The message is follow the passenger. It's not the flight. Follow the passenger. Whoever is coming in, you have been in India for the last period of time, put them under isolation. Check their result. Follow up with what it is. That's the problem. I don't know how many people coming from India now. Maybe you may begin to wonder. But if you are doing it at your own expense, then of course that will reduce the number that will come in, and we can easily target such things.
Okay, can you quickly tell us about what you know about the variants, the Indian variant, for example? Is the vaccine able to respond to it effectively?
So far, we have little or no knowledge about that. The Indians are still using their own vaccine. And we know that the cases are still coming up. So we don't really know now. It's an unfolding issue. Numbers have not gone down in India, even though they are vaccinated. So we don't really know. But bear in mind, even when Britain decided to do its vaccination, the British Prime Minister actually said that more of the positive effect came from the lockdown rather than from the vaccine. Yes, vaccine did some, but then the lockdown kept the spread. The reason for that is that so long as you have people spreading the thing, variants will come. And the more variants you have, the less the chance. You don't know whether your vaccine is going to meet the new variant that is coming. So the less of variants we have, then the less of the escape from the vaccine. And how do you get the less of variants? So that you stop transmission. Wear your face mask, you avoid all the big congregations of people. And now the situation in India is always coming. They were doing well before. And then they have political campaigns in different states. And then they have this ceremony at the Ganges. And that's what is leading to a problem. We have abandoned NPI. And I don't know whether the Ramadan festival will be a major thing, but I don't know. It's a gathering of people. How we monitor that could also determine whether we're going to get the third wave or not.
As always, thank you so much, Professor Oyewale Tomori, for your insights.